This morning, Dr. Kothary, the Chief Medical Officer for Dignity Health of the Central California Division, to give us the latest update on coronavirus pandemic and what he's seen here in our own community. Dr. Kothary, thanks so much for joining us once again, sir.
Oh, thank you, Maddie, for having me.
All right, so let's talk about the curve. We like to start off with this every morning and kind of talk about what we're seeing both on a nationwide and a statewide and, of course, a local level. First, though, let's start nationwide. Going off the data from Johns Hopkins University, it looks like the nation's curve is beginning that downward trend. Can you tell us what you're seeing and what that means?
Yeah, we're starting to see a little bit of flattening in certain areas, especially New York. We've seen the death rate decline just a little bit, which is very encouraging. However, in Kern County, we're seeing an uprise in the curve. We have a major upswing. We've had a lot more positives. If you look at the amount of cases that we've had since 3 weeks ago, it's a linear trajectory going straight up.
Yeah, and we saw that yesterday with 50 new cases diagnosed, the most that we've seen diagnosed in one day. And you've been talking a lot about what's happening in LA because you say that we're about a week and a half or so behind LA, so we can kind of judge where we could be heading on where they are right now. Well, yesterday, the Los Angeles County Department of Public Health confirmed 25 new deaths and 239 new cases of COVID-19. And that was actually the smallest increase in new cases that the county has seen, LA County has seen, since March 26th. What does that tell you?
That tells me some of the tactics we've been talking about, primarily being social distancing, seems to be working. I think the people of Los Angeles have been paying attention. I also believe the people of Kern County have been paying attention. So I think we may get lesser of a spike in the curve, more flattening coming up. And our surge will also be pushed further out as well.
So does that mean if LA continues on their trend, is actually flattening and starting their downward trend, could we be a week and a half or a week behind them, and when we'll start to see that flattening and downward trend here in Kern?
And that is my prediction, yes.
Okay, so we know that testing is still pretty scarce here. And if you have mild symptoms of coronavirus, you're not likely to get a test. And we know there are a lot of mild cases out there, including those who are asymptomatic. What would a mild case look like for someone who could be thinking, well, is this just a cold? Is this my allergies? If someone, for instance, has had a persistent cough but never had a fever or anything like that, what would a mild case of COVID-19 look like?
It would be a blend between a case of the flu and a case of the cold. So it'd be a mix. And so what you'd see is you may see low-grade fevers, you may get a cough, you may get a little short of breath, you may get a little diarrhea. And so it'd be mild stuff. So it'd be stuff that you can stay at home for, and that you'd say, if this was the flu, I could probably stay at home for this.
So what should you do, though, in that instance, if you do have a very mild case? How long should you just self-isolate? Should you just go ahead and assume you have it? Do you wear a mask at all times? And how long do you need to follow those conditions?
So what we're telling people is to self-quarantine for at least 14 days, especially if you don't know. And, if your symptoms go away within those 14 days, then you're probably fine. You're probably clear. You probably had it. You're done. Now, we'll know more once the CDC approves these antibody tests. A lot of people are very curious about this and want to get tested and see did they really have it or not. And that's what these tests will help us with.
They're already doing these tests, though, here in town. But you're saying they're not approved yet?
The CDC has not come out with a recommendation for these tests yet. We're waiting on the CDC so that the hospitals, we can go ahead and start purchasing them and start doing our testing.
What does that mean about other places that are already doing these antibody testing? We know, lots of places around the country. LA, for instance, is doing these a lot as well already.
Yeah, and a lot of them are FDA approved. Or I know at least 2 of them are, but we really are in the healthcare field of watching the CDC and following all their guidelines. We've decided as a company, Dignity Health and Common Spirit Health, that's what we're going to do. Is whatever the CDC says, that's going to be the guidelines we follow. Okay.
So back to mild cases of COVID-19. If you have a mild case, or even if you suspect that you have a mild case, is there anything that you can do to keep it from worsening or advancing?
There's a lot of anecdotal data, but typically not. This thing has just got to run its course. There's some data that says if you take zinc, it may help. I don't really think any of that stuff works. It may, but for the most part, yeah, just let it run its course.
And now, I know recommendations for things like pneumonia include getting up and walking if you can. Basically, you want to try and exercise your lungs just a little bit, right? Is that something that would be recommended for COVID-19 as well?
Yeah, absolutely. You want to do some stuff. You don't want to push yourself too hard. One of the things with COVID is it does affect the lungs. So it will make you short of breath. It's going to get you really tired as well because you're not oxygenating your body as well.
Okay. All right. Dr. Kothary, we are out of time this morning, but we thank you for joining us again, sir. We have so many questions. We don't seem to ever get to all of them. And we want to let our viewers know we have not been able to continue those Facebook Lives right now. We're going to try and get those going again because I know so many people out there have their own questions. If you have a pressing question for Dr. Kothary, please email it to us and we'll try and ask him that. sunrise@kget.com. Dr. Kothary, thanks for your time again, sir. We'll see you tomorrow morning.
Well, thank you, Maddie.
All right. On to our 17